The number of people who traveled from the Western Cape to the Eastern Cape that have tested positive for COVID-19 is now 137. This represents 57 more new cases of people who've tested positive who entered the Eastern Cape through Tsitsikamma and the Aberdeen during the grace period of interprovincial traveling. Eastern Cape Health MEC Sindiswa Gomba says she was concerned about the numbers of positive cases continuously going up. We have her now on the line. MEC Gomba, thank you so much for making the time this morning. This interprovincial travel has now left the province's number of confirmed cases at 1,078 as of Saturday night. What's the plan to try and curb this increase?
It does. We anticipated this once immediately got 57. During the week, we had confirmed numbers of 57. That is the reason that we actually were immediately dispatching more vehicles to our areas. And we dispatched 1 more vehicles because the numbers that were indicating that we have got some challenge in our Tambo, in Buffalo, the municipality, Tole and Freinet. And look at these issues. We're immediately saying we need to immediately follow them and their conducts, and would not be able to do that if we're not able to add on how people are able to get to those people. The number itself is worrisome, and we are worried if we could be getting more delayed results in terms of those numbers.
And our line is not very clear, but we'll continue trying to make it better. But is it true that the majority of the new positive cases, as you've just stated, Ora Tambo is a worrisome place, Buffalo City Metro, Amatole and Graaff-Reinet. And why is this? Do we know?
Well, I would not know. All I know currently is that we've got an influx of these people that came in due to them coming back from farms of cereals in the Western Cape, and equally some funerals that is to attend. For instance, in Graaff-Reinet, there was a funeral of people coming from the Western Cape. Also in the villages in Buffalo City, there were 2 funerals of people who came to bury people who had already died, and they were all coming from Western Cape. So in a sense, one would not be sure whether they linked to being positive before, which could be what we could actually synthesize together with the Western Cape. Maybe we've got common numbers. If we are able to actually deal with that, then we can be sure that it is new cases that we found because of COVID-19 as they entered the Eastern Cape.
Earlier, about a month or so ago, a few weeks ago, the Minister of Health, Dr. Zweli Mkhize, came through to the Eastern Cape and he was decrying the fact that the province was not necessarily COVID-19 ready, and some resources and capabilities were sent through to the province. Now that we're seeing an increase in numbers, is this an indication of the testing and screening facilities improving in the province?
It is not that factor. There was improved screening at the time that Dr. Zweli was here. We were well over 600,000 in terms of testing. So that number alone does not say we're slack at any area and point in time. What actually assisted us in terms of Dr. Zweli Mkhize's team being here was that instead of us having 1 epidemiologist, we're having now 4, which were able to actually deal with all what we're actually analyzing, and a better approach to dealing with our both screening and testing. My view is that the assistance of the national office was quite welcome on the basis that he came to assist us at the point that our numbers were going up. However, the numbers, if it was working, it would not have had a contribution of the travel from the Western Cape, both in Aberdeen and Tsitsikamma. So those are new totally that would not have been stopped by any other intervention.
MEC, are you able to give us numbers at this point in terms of people who have tested positive, the ones who are self-isolating or quarantined, and the ones who are in hospital, and the different hospitalization levels?
Unfortunately, not at this time, and at the time of me having this report. For instance, when I was told that we were going to go on Skype, I was worried because I had gone out of the house and left my iPad at home, but felt I would not say I'm not taking your call because of that. However, I'm able to recall some numbers I know in terms of our recoveries, that now we're standing at 519 recoveries. But also, in terms of the number, remember the story about the Aberdeen and Tsitsikamma borders also goes together with the quarantine that we actually opened in Fish River and Pegwin. And that 110 that we quarantined, we are lucky that there was nobody positive in terms of that. And as to the deaths, we're standing at 22 deaths currently.
MEC, thank you for talking to us this afternoon.
Thank you. Thanks, Des.